immunization in two particular areas. One is healthcare workers and flu vaccination, which is the season as well upon us. And the second one is childhood vaccination. My background is I'm on the public health board, just recently added onto the board. I used to work in public health in the state of New Hampshire in the state agency. One of the jobs I had for 5 years was to manage the state immunization program. So that was what the connection was as to why I'm very interested in this vaccination issue and helping to create one of these data briefs. I want to make a reminder that we're going to have this set up so that the people that are speaking will appear on screen, and everybody else could turn off their video if you would. It would just help to reduce the amount of data flowing through the Zoom system. And we have three distinguished panelists with us today. And we're going to start off, I'm going to introduce them, and then we're going to start off with some questions related to the healthcare worker flu vaccination data brief. One of our speakers is Patrick Vivier, MD, PhD. He's a director and executive committee member, Hassenfield Child Health Innovation Institute. He's a professor of health services, policy and practice at Brown University School of Public Health. And he's also a professor of pediatrics and emergency medicine at the Warren Alpert Medical School at Brown University. We also have John Fulton, PhD, and John is a chronic disease epidemiologist, and his work is focused on reducing the burden of women's cancer, but is also extended to other areas. For 30 years, he worked for the Rhode Island Department of Health, 20 of those years as an associate director of health with several assignments. One that is most pertinent to things going on today in public health is that he had 10 years leading a division of the disease control and prevention and worked as a supervisor to address H1N1 pandemic, and was assigned to help with the planning and coordinate the prioritization of distribution of H1N1 vaccine. Like myself, he retired from that Department of Health, but in March 20, unlike myself, he was recalled to the Rhode Island Department of Health as a volunteer to staff the state's epidemic modeling effort with Dr. Tom Chikalinos and other faculty colleagues from the School of Public Health. And that basically means he's working on how to model the distribution and prioritization for the COVID-19 vaccine. So very important current work. And then we also have Kathleen Pierce, RN, MS, and she is the Vice President of Clinical Operations and Chief Nursing Officer for the VNA Care of Rhode Island. I hope I have that right. And is that correct, Kathleen?
VNA of Care New England.
Yeah, thank you. And she is going to speak on some of our questions related to the healthcare worker and flu vaccination. We also can take questions once we've gone through our list of questions. If you want to put any questions in, you would do it through the chat room function at the lower part of your screen. And then Patty Rissica, who is the host of this Zoom event, will take a look at those and put some of them forward as we have time, and depending on what time we have and what fits what we're talking about. So I'm going to start off with to ask the panel one by one to respond to 5 questions we have. And the first one is a really broad question related to flu vaccination for healthcare workers, and just a general discussion about why is it important for healthcare workers to receive timely annual vaccination for the prevention of influenza. So who would like to take that question first? Kathy, go right ahead. Thank you.
Sure. So why is it important for healthcare workers? So I'm a nurse. I manage a home care agency, And but I've worked acute care as well, and I would say healthcare workers have the most exposure to patients when they are at their most vulnerable and most able to catch disease. So the first reason I would say healthcare workers need it is so that they themselves do not inadvertently bring flu vaccine to any patients. And the second reason we need it is because we are dealing with this population that in fact we could get it from. And so to be able to take care of patients, we have to keep ourselves healthy. In the home care setting, we see mostly elderly people, 70s, 80s, 90s. They're very frail. They are homebound in a lot of situations, don't leave their home. And it's just like the dominoes. It's just going to take one thing that puts them over the edge. And the flu is a deadly virus. And so that's why it's absolutely essential that we are vaccinated for flu vaccine.
Okay, other comments from the other two panelists on that question?
I would just like to add that we have very substantial evidence this year about how infections get into long-term care facilities because of COVID-19. As you folks know, between 70 and 80% of the deaths from COVID-19 in Rhode Island have been from long-term care and other congregate care facilities in the state. Now, of course, these people, most of these people, 8,500, for example, folks in long-term care facilities, are not ambulatory. They're not getting out and about, and they are not getting exposed to COVID-19 in bars or restaurants, so on and so forth. They are living in a contained environment in which, of course, COVID-19 did not exist, except when it was brought into that environment. Now, not only by healthcare workers, of course, by family members initially, and so on and so forth, but certainly anyone who comes into that otherwise, let's call it sterile, it's not sterile, but otherwise, otherwise unexposed environment really needs to be vaccinated so as not to set off the kind of epidemics that we saw rampant this April and May in our chronic care facilities.
Would you like to add to that, Dr. Vivier?
Well, I would echo the two really important points that has been brought up. Obviously, occupational safety. That healthcare workers are at risk. Critically part of what healthcare workers need to do to protect their patients, as Dr. Fulton was just saying, of not introducing it. And I do think there's a third reason, and that is setting an example. I think as healthcare providers, we have to set that example of the importance of immunization and going forward and getting them ourselves when it's important that we get protected.
Thank you very much. I'll move on to the next question. This question involves the current pandemic and flu vaccination and how those two things are related. So the question is, how does the public health risk of COVID-19 pandemic relate to the 2021 flu season and vaccination of healthcare workers, for example, protection of the service system and the people they serve? But also this question of comorbidities and whether it's easy to distinguish one thing from the other, that type of thing. So would you like to go first again, Kathy, on that?
Sure. I think, we're seeing less flu this year because people are wearing masks and not giving it to each other as much. So we are seeing less. I mean, at Care New England, we require people to have a flu vaccine. The only way you cannot have a flu vaccine is if you have a medical exemption. And so even though people might not want it, they know it's a requirement to work here. So I see very good compliance with it and less illness related to it. And how does it relate to COVID-19? I mean, I think there's so much fear with COVID-19. When we went through the beginning of the pandemic here in the springtime, we had a lot of patients calling us saying, don't come out anymore. I don't want anyone in my home, as they were so afraid to have anyone there, but they were sick and they really needed care. And so they could last for a little while. It's kind of like no one went into the emergency departments, but then all of a sudden you started to see that they desperately needed care. And the interesting piece I see coming at now when we're peaking again is that patients aren't calling saying don't come, but they're being selective. Okay, I can have this service and this service. Can we have the same person all the time? Everyone's better about wearing masks. So I think, you know, the vaccine, unfortunately, has taken on a political agenda, if you will. And some people don't want it because whatever they've heard on TV, whatever their political association is. And I do agree with what Patrick said about leading by example. And so Care New England just got the COVID-19 vaccine, and the presidents of each of the operating units, including myself, went first because staff were kind of, some people were like, me first, but a lot of people were saying, well, are you going to get it? Yeah, you want us to get it, but are you really going to get it? So by going first, I actually said to someone who was there, hey, take a picture of me. They did. And I sent it out to all my staff to say how important it was, how lucky we were to be included in this. And, you know, some people are great. They're just calling them to say, okay, you're next. Do you want it? And they're like, yes, they're almost crying. They're so happy to get it. So it's interesting how the vaccine, you know, it's brought so much light to it. And I think making everyone think about, why do we get vaccinated? Because these diseases are deadly. And I think people don't give enough credence to the flu, that how many people die every year from the flu. I mean, yes, we're hearing more about it with COVID-19, but because flu becomes kind of ordinary, if you will, and we get used to it. And so I think this year vaccination is just front and center on everyone's mind of how do we get through this? What do we do to keep ourselves safe?
Thank you, John or Patrick. Other comments?
Just from the COVID standpoint, of course, I've been following the numbers daily for months now. And as we all know, the hospitals are rather filled up at the present time. We've opened 2 sort of extended care sites in Cranston and in Providence. And not only are our beds filled, but of course we're facing a severe staffing shortage. And of course it could get worse because despite the fact that we are getting vaccine, COVID vaccine, we have received 9,000 doses so far. There are more than 50,000 healthcare workers in the state, somewhere between 50 and perhaps 60, 65 healthcare workers in the state. So clearly we are not going to get them vaccinated for COVID-19 quickly, which means what? Some of them, of course, unfortunately, in harm's way, will become exposed and either have to quarantine or isolate for some period of time, again, contributing to staff shortage. So in such a situation, certainly we do not want beds to be filled with a disease like folks having a disease like influenza, which is largely preventable by vaccination. Again, Kathy mentioned deaths. You know, just a comment about that. In Rhode Island, we estimate between 100 and 200 influenza deaths, officially influenza deaths per year, but there are actually many, many more. Traditionally, we have let's say an epidemic of deaths between 4 and 6 weeks following, or peaking 4 to 6 weeks following the peak of the influenza epidemic, because people who are frail and suffering from chronic illnesses, so on and so forth, have received such physical insults from influenza and frequently the pneumonia that follows it, that they simply they've lost sufficient organ reserve that they die. So this is a big problem every year, and it's a big enough problem every year. And we certainly want to prevent something like that.
And Dr. Vivier?
Yeah, I would echo Dr. Fulton on this, that there is so much we can't control right now around COVID. There are important things we can do. We can wear masks, we can socially distance, but we do not have enough vaccine for everyone. And so, but there are things we can do. In influenza, we have a vaccine. And so when we're seeing this new threat of COVID, it is important that we also keep our eye on the ball of existing threats that we can do something about. We can all, I've already been vaccinated for the flu. We can all get a flu shot if it has not happened already. It absolutely must happen because, again, focus on the things that we can do something. We can't all get the COVID vaccine right now, but we can all be immunized for the flu. And those are deaths we can prevent. Those are hospitalizations we can prevent. And at a time when our healthcare system is so stressed with COVID, and at a time where we've just had, as a society, so much loss of life and illness for something that we haven't had all the tools we'd like to have, it's just a shame if we're not using the tools to fight things like influenza.
Thank you. The next question is about the safety of flu vaccine. And of course, that's also an issue with the question with the COVID-19. So I would ask of those of you that want to make a comment, what is the safety of flu vaccine versus the risk?
May I ask Dr. Vivier to answer that question first? I'd be glad to comment and perhaps get the other comment.
Sure.
Yeah, I'm sure we can all weigh in. Very, very clear that the vaccine is far better approach than letting influenza happen. And so influenza vaccine is a safe vaccine. As we know each year, it's not always 100% effective, but as a population using it, it can have a dramatic effect. And the benefits of the vaccine far outweigh any concerns. And, whenever we do any medical intervention, there is always the chance of reactions and other things as we see. But on balance, that risk is far smaller than the benefit that we see from the disease of influenza.
Just want to add that the primary risk from the vaccination is amongst persons who have had allergic reactions in the past, and all vaccine providers are equipped to deal with an anaphylactic reaction medically. It's not that difficult to do so, as someone who worked with those numbers at the Rhode Island Department of Health, there are very, very, very few really serious, very, very few serious side effects of administration of influenza vaccine. After all, we attempt to vaccinate, remember, over half the population of Rhode Island, and we did in the last influenza season, as the excellent brief mentioned. That's a lot. That's a lot of vaccine and a lot of arms, and there were very, 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 very few serious side effects.
Kathy, any other comments on that?
The only thing I would add is I said it's mandatory for staff that work here and at the VNA. We have about 220 staff, and I think we have 2 to 3% that get medical exemptions from taking it, and everyone else does fine with no reaction. And I think that speaks to how many people can get the vaccine safely.
Thank you.
Mike, if you don't mind, just a comment about the COVID-19 vaccine, because I want to just clarify something. All of our listeners probably know that of course, one of the vaccines administered in England resulted in 2 anaphylactic reactions. Just want to make sure that everyone understands that the 2 people who had the anaphylactic reactions to the vaccine, first of all, are fine now. Secondly, we're both carrying EpiPens. So these are persons who had very significant risk of allergic reaction and so on and so forth. and again, both were taken care of, so on and so forth. This out of now, again, in terms of say both Pfizer and Moderna themselves, as opposed to AstraZeneca vaccine, so on and so forth. We've immunized about 90,000 people just in trials, and again, you've heard of very, very, very few untoward reactions.
So the last, second last question, based on the Rhode Island Public Health Association data brief on this topic, are there any concerns or surprises that you would like to comment on in terms of what you saw in the data brief? I'll leave that open-ended because you may not have any surprises.
If I may comment, I was not, again, the brief did demonstrate that vaccine coverage of childhood vaccines is extremely high in Rhode Island. That was not a shock to me. That's a long-standing fact. Nevertheless, I wasn't shocked, but I was still concerned, obviously, that we're not even higher than we are. We're not closer to 100%, and also that we are within whatever 24 months, not better than we are, say, prior to school enrollment, is still very much a concern to me. Children should be vaccinated as soon as they are eligible for vaccination, and by golly, we really should, we should complete series on time and so on. So that's a concern to me. We still have a ways to go.
Any other comments?
I think
Kathy?
the sentence in there that strikes me the most is, I think when people make these decisions about themselves or their children, they think they're making this decision for one person, and in fact they're affecting the entire community, because community-wide protection is part of what vaccines give us. And if enough people start not taking it or not having their children take it, it will affect how we move forward. And I think people keep thinking it's an individual choice, but it does affect others. And people don't like to be told what they have required to do. So I think the fear and the lack of knowledge about some of these vaccines is what leads people to make some of these decisions.
And I will make a note that we shifted from the healthcare worker data brief to the child vaccination data brief, which was going to be our next.
Oh, sorry, so sorry.
That's okay, because
Well,
you can get a little ahead. It's still the same topic, vaccination. So I'm just making a note that I perceive that shift happening.
Mike,
Dr. Vivier, any comments from you on this?
Yeah, Mike, before we do that shift, I think as we're making that shift, a couple of things that really struck me. First of all, thank you to the Rhode Island Public Health Association for doing the briefs and calling this attention and for having the event. One of the things that was really interesting to me, again, as we make this transition of reading the influenza and healthcare workers and then reading the childhood, is, we set a bar of where we want to be. And Rhode Island has every right to be proud of the national comparisons of how we do in both of those camps. I think it is a tremendous tribute to the state, to our state leadership, current leader, Dr. Nicole Alexander Scott, who's fabulous, and her predecessors, the primary care communities and citizens who do this, that in this comparison nationally, how well we do. Now, having said that, it still means that just over half of people get the flu shot. And when we look at as we transition to childhood, those numbers are in the high 90s. And again, that's thrilling, but that's a big discrepancy. Now, granted, flu has to happen every year, but kids, each year there's a new crop that have to be immunized. And so I just think that we can be proud of how we're doing relative to other places in the country and relative to goals. But these numbers still show a lot of people left vulnerable to diseases. And you know, starting with influenza, we're almost half not getting that vaccine. And even among the healthcare workers, where again, we're doing terrific, particularly in some disciplines, there are still disciplines where a lot of them are not getting immunized. And so I think that, not that it was a surprise, but I think it's important to do these briefs and have these discussions that we again celebrate the success, but also really recognize that this should be 100%, or it should be very, very close to 100%. These are tremendously impactful interventions that are cost effective. We have them available. It's not like this fear that we had at COVID in the spring of when would a vaccine, when could we possibly ever get this answer? We have important answers for so many of these diseases. And while we've had tremendous impact, there's still a lot more we can do. And I think those were the important take-home messages for me as I was reading the influenza and looking at it in comparison to childhood. So I just want to make that statement as we move to the childhood discussion.
Yeah, I would just, thank you, Dr. Vivier. I would just underscore something that's said about the providers and, you know, direct everyone's attention to that with regard to flu vaccine, the table on types of medical providers who did not receive the flu vaccine during the 2018-19 flu season. I'm noting that that 20%, so 1 out of 5, over 20%, so more than 1 out of 5 of home nursing staff did not receive a flu shot. And folks in other home care, again, around 20, a little bit higher than 20%, 1 out of 5. And remembering that one is able to transmit the flu at least a day before symptoms. I'm still flabbergasted that there's that kind of proportion of healthcare provider who are not willing to protect patients.
Yeah, and I would just point out that the data that was available through the Rhode Island Department of Health had tracked the flu vaccination rates by facility, but they did not break it down by the type of worker. So when you've got one facility that's coming in kind of on a low side, it's all of the workers combined into one bucket. It's not, you know, the nurses, the physicians, and then the CNAs. And so therefore that's why you see that low level in certain ones more than others. And then the other question, of course, was whether it was mandated by the facility, which not every place does. It's not required by law. So
I think Dr. Vivier and I are saying it is mandated by reason, but
yeah,
who are we to say?
Public health safety.
Yeah, and again, also, whether you're a doctor or a nurse or whatever you're working in that facility, you are still a healthcare provider. You know, even whatever your job is in that facility, you are part of that. And all of the things that we just said, whether it's setting that example, protecting yourself from the occupational exposure, and in some ways, most importantly, protecting the people you serve, regardless of what your role in that facility is. If you're in that facility, all three of those things still really matter.
Yeah, thank you. Patty, were there any questions that have come in through the chat room on this topic?
Yes, I just sent one to you from student Isabel Wensley.
All right, I'll see if I can pull that up. I see it.
I can read it for you if you'd like.
Yeah, I see it here. It's how can we quell the fears of people who are claiming that the COVID-19 vaccine was rushed and didn't go through proper procedures? Are there communication strategies that can be utilized? It's a good question. Who wants to take a shot at that?
Dr. Fulton, sounds like you've been very involved. Why don't you take the first crack at that?
Thank you, Dr. Vivier. Look, I have read, and these are available for you all to read, the briefs their briefs, their 50 pages, whatever they are, their briefs that were presented to the FDA by both Pfizer and Moderna. As you, again, just so that everybody knows, again, FDA is considering Moderna today. It's possible that we get some kind of a decision as early as today from the FDA panel. The data are the data. These clinical trials, in my opinion, on the basis of the reports that I've read, were extremely well done. These clinical trials were done on very diverse, large, very diverse populations, diverse by age, gender, race and ethnicity, other factors as well, I might add. Very, very few side effects other than the normal, normal sore arm, in some cases, sort of flu-like symptoms for a day or two, that sort of thing, which is expected. And very, very high rates, very, very high efficacy, very, very, very high efficacy indeed. Very few, by the way, well, let me just say that both of these reports were very, very well documented. Anybody can look at the data and so on. Now, again, in terms of rush, one needs to ask anyone who has worked in a bureaucracy, and I'm not trying to cast aspersions, but I have worked for the three great bureaucracies in the world: the university, right, Dr. Vivier, the state, the government, and also the church. And I can say this, that the wheels of bureaucracy grind slowly. So yes, this has been a faster process than heretofore. But one must ask, to what extent was the duration of the heretofore necessary, or simply the bureaucracy doing things at its own pace because people wanted to take all of their vacation before the end of the year, and so on and so forth. Thank you.
Thank you. Dr. Vivier.
Yeah, well, I would also add, I mean, first of all, I think that if we are going to respond to people's concerns, we first have to validate them, right? This feels different. It's a very quick, first of all, I think even less the approval of it being quick is the development of it was very, very fast. And I think that's because it's a new technology, and incredible that people have devoted this. So I think we first have to validate that these are important questions to ask. If people are asking them, let's give them the information. And that's why, sharing the information that Dr. Fulton had, give the facts, let people know. I think as more transparent as we can be, that reassures people. I'll also say, for me personally, I'm a physician. I've not been doing COVID vaccine research. I've not even looked at the numbers quite as much as Dr. Fulton. But I do know the people like Dr. Nicole Alexander Scott, the history of not just when we talk about, it's not just the FDA, right? It's ACIP and the CDC and each state of very dedicated people like Dr. Fulton, Dr. Alexander Scott, who are looking at this very closely and giving their okay. And so I think that for me, what's reassuring is not only that it's gone through that process, but the heterogeneity of folks who have weighed in and said, that this is safe and ready to go. And I think also in any intervention that we do in medicine, every medication you take, there is a balance of potentially negative side effects and the benefit. And we're always walking that balance. We really can't forget, I don't think there's any danger that COVID is suddenly becoming old, but we can't become immune to the fact that this is something we didn't even know about a year ago. And we read in the newspapers that Southern California hospitals are full. So this is having a dramatic impact. We now have a vaccine that has gone through all of the data that Dr. Fulton was saying and has been encouraged by the top people that we trust, who not only are using their words, but are, as one of our panelists just said, getting that shot and getting it on camera to make sure. So I think, again, leading by example, answering questions, and really being transparent about this data in the way that Dr. Fulton did is the way that we have to move forward to reassure people.
All right, great. Thank you very much. I'm going to shift to.
Can I just?
Oh, you have it. Yeah.
Yeah, I just want to throw out two more things, and thank you so much, Drs. Vivier and Fulton, for responding to that really important question. It's really been brought to our attention also that this technology, the mRNA technology, is not brand new. It's actually been in development for many years. So it was utilizing a pathway that was already in process. So it's not like all of that happened in the last year. And then secondly, we don't only have one vaccine. We have right now, it looks like maybe today, 2 that are going to be approved, but there are 2 others in the pipeline. So 4 different mechanisms to develop vaccines happening at the same time in roughly the same time period. So that to me gives me comfort that, it's not like one was able to do it and the rest are all saying, what are you doing? Because our process is taking much longer. All of the processes took about the same amount of time. So to me, that gives me comfort and confidence in addition to all the other reasons you said.
And as the moderator, I'll make one comment. I try to refrain from doing that, but one of the thoughts that's going through my mind is when we look back on this a year or 2 from now, what will be the comparison of the uptake of the COVID-19 vaccine as compared to the flu vaccine, which are both mostly a voluntary vaccine? And will the morbidity and mortality related to COVID-19 create a greater uptake than what we've seen with the flu? And certainly looking at the numbers and the data on that, maybe would have tipped it towards greater acceptance. So that would be something to look back at and see from a comparison level. So if we could move to childhood vaccines, and I think we've had some comments already on the first question, to talk a few minutes about the importance of childhood vaccination, but is there anything to add to what already was said a little bit earlier?
I want to give a demographer's perspective, a little bit different here. How important are childhood vaccines, or how effective are childhood vaccines? Childhood vaccines single-handedly caused what we call the demographic transition. Post-World War II, we got childhood vaccines out to most third world countries, developing countries, whatever, as you will. And this caused the famous population explosion that we were very concerned with, much more concerned with, I think, in the 60s and 70s, so on and so forth, because people's fertility rates had not yet caught up with mortality. What I mean by that was people before childhood vaccines in a developing country, so on and so forth, would have many more children. Why? Because they lost so many babies and young children to childhood infectious diseases. That's when we immunized these children. Again, it took a while for the world to kind of adjust to this, which caused a large increase in the population. But that increase was such incontrovertible evidence of the effectiveness of these vaccines, and showed us what tremendous kind of human, if you will, wastage we had experienced before childhood vaccines worldwide. So this childhood vaccination is huge in terms of saving children around the world, saving children's lives around the world, and by the way, adding a great deal, for reasons that are obvious, to estimates of longevity and so on and so forth. Thank you.
Yeah, I don't think you can overstate the importance and the impact, of childhood or the routine immunizations. If we think of the diseases of smallpox no longer existing in the world as the first one, but as we've seen sort of this fear of COVID come into communities, anyone who's studied history of not that long ago history, that sort of fear swept in when polio would come into communities. And we have not seen a case of polio, wild polio in this country in decades. So something that was front and center of the worry of parents in the 1950s doesn't exist. And it's interesting to me, just as I teach at the School of Public Health, I teach in the medical school over the years as well. When I give talks on immunizations, I would always start off with a slide of smallpox. Have you seen anyone who's had this? And of course, no one, they can't, they're not old enough. But as I go through it, there are more and more diseases. I've not seen smallpox either, but diseases that were quite common when I was a child, where I knew people who had been very much affected by this. When I gave this lecture this fall, the number of those diseases, when I'd ask the class, do you know anyone who's ever had this? It increases almost each year, that of things they just don't know. Or in the hospital teaching and saying, what causes this disease? And what was the leading cause when I was a resident? They don't even know to give that answer now because it was taken away by these vaccines. So when you see things like the CDC naming it one of the top 10 public health accomplishments of the 20th century, that is, whether you're looking at that demographically in the way that Dr. Fulton was talking about, whether you're looking at it by disease rates, or whether you just talk with people, talk with your parents, your grandparents, of the fear and the burden that they saw firsthand that next generations are just not even aware of. And so we just can't take for granted the importance of this, one of the most effective and most cost-effective ways that we can prevent death, that we can prevent suffering. And so it just can't be overstated.
By the way, on a personal note, if I'm allowed,
Sure.
I did have the measles. Of course, I'm a little older than Dr. Vivier. I did have the measles as a child. I was semi-comatose for over a week. I ran a fever of 104 for over a week, and it spiked to 107. This was I was not hospitalized, but I was just about there. And as I like to tell my mom, imagine how smart I would be if I hadn't had the measles.
You seem to have recovered well, but that is a harrowing story.
Yeah.
Let's go to the next question. And we've talked a little bit about this, but feel free to express any additional thoughts you have. What are some reasons behind refusal of childhood vaccines that they are seeing, that you are seeing, as you look into that?
Dr. Vivier, why don't you take that one?
Yeah, I think this gets to be a difficult one in a number of ways. One, again, any intervention we do, there is the potential for whether allergic reactions of some of the things Dr. Fulton was talking about. And we don't want to deny that. Vaccines can have side effects. They can have things. They're well known, but there is this risk-benefit ratio, and it is overwhelming the benefit of these vaccines. And so I think, again, some of it is being transparent, not dismissing fears, engaging families, talking about what it is, and trying to do this honestly in a forthright manner. I also think, unfortunately, we're at a particular stage in our world where misinformation, disinformation, has become more and more a problem, and it can become more and more difficult to discuss these things. And so I just think it's critical that trusted sources continue to have that conversation to make it very clear of the overwhelming risk-benefit ratio of these stories that we tell, and these numbers that we have of these diseases going down, these deaths going down, and the really overall excellent safety of vaccines.
Thank you. And the next question is connected back again to COVID-19, and I'm going to add a bit of an addendum to it. So do you feel that the COVID-19 pandemic will increase or decrease the uptake of childhood vaccines seen in Rhode Island? And related to that, I'm wondering about, has there been reduction in parents being able to get their children vaccinated due to fear of, going to get that routine immunization related to not wanting to be exposed to COVID, in different environments?
Let me just say that we do know that there was certainly during the shutdown early on, there were disruptions in the delivery of medical care, especially well child and just normal physical exams for adults my age, that sort of thing. So we know we were set back a little bit, but that was for maybe between 1 and 2 months. And I do believe that we have, certainly with regard to hospital procedures, we've gone a long way to catching up with, again, those kind of, just a parallel concept with elective procedures and so on.
Yeah, I think the capacity's there. I think in primary care practices, the capacity's there. And I do think we have to be, vigilant about that. Dr. Fulton might know the immunization numbers. I've not seen them here in the state, but certainly nationally, this has been raised, of whether it's measured by the vaccine distribution or vaccine uptake. It's not that people can't get vaccines, but that concern of not going out. We wish that concern would be emphasized in group functions, like let's not do that. But if your child needs vaccines, please go get the vaccines, because the last thing we need on top of a COVID outbreak and potentially influenza outbreak is having a measles outbreak or something more. So again, echo something I said earlier. Let's please protect the things we can protect while we struggle with the things we can't protect.
Okay, and then this is the last question, but there may be a few more in the chat room. I think I saw one. Your feelings on how Rhode Island compares to the rest of the states in terms of childhood vaccination. So that was, clearly outlined in the data brief, and what your questions of that are, or comments on that.
I'll echo things I said before, if that's okay, Dr. Fulton. We have every right as a state to be proud. There's always the ability to complain about our government or complain about anything we want to complain about. We've had outstanding leadership in this state. If we start at the government level, going back, I remember in the early mid-90s of setting up immunization tracking systems, making sure vaccine availability at no cost. Incredible people who dedicated themselves, that we're now seeing decades later, this impressive impact. And so certainly the Rhode Island Department of Health, Rhode Island state government, all of the partners who've done that, and an incredible network of primary care providers in the state. I don't think we can overstate that as well. Pediatricians and family physicians who've been dedicated to that, and Rhode Islanders who get the vaccine. And so I think this national comparison is something that Rhode Island can feel really good about. But as we've said before, we also need to look at these numbers and say, why isn't it 100%? And where can we get it up to that? Again, not only just the endpoint, do they finally get their vaccines, but how many weeks or months did they go with a delay and put an unnecessary risk for families? And so I think there's still lots of room to continue to improve immunization delivery, our commitment to this. And I think also, again, I think we can get frustrated about some of the disinformation around vaccine refusals, but understanding there are legitimate concerns people have and making sure we always respectfully address them, continue to try to make our vaccines as safe as possible, and to be transparent with the numbers so that we're dealing with those numbers. So as I said before, I think it's both sides of a coin of feeling amazing at what's been accomplished in this state relative to what others are able to accomplish, but also the numbers very clearly demonstrating that there's more work to be done.
Dr. Fulton, any comments on that?
I just agree with everything Dr. Vivier just said and underscore it. I would just also say this. This is Rhode Island has a proud history of being a portal of entry into this country. We are a state of immigrants, and we have been forever. One wave after the next, after the next, after the next. People, immigrants tend to be young working adults, healthy young working adults. Some of them come as families and bring children. And one of the things that we can also be proud about in Rhode Island is how quickly these families have been integrated into healthcare, and that these children have been assessed and, if necessary, immunized, and so on. We've had several largish refugee groups settle in Rhode Island over the years, certainly in my tenure at the health department. And again, not so much the health departments, this is not so much the health department, kudos to the health department, kudos to all of those community-based organizations that really reach out, refugees, immigrants, so on and so forth, bring them in, support them, and assist them in getting into good, solid medical care as quickly as possible.
Thank you very much. I think we're running down to the last 5 minutes. I do have 1 or 2 questions in the chat room. I'll take a look at those and then we'll close. So let's see. Okay, so this is just a general comment, I think. It says latency by the general public in the future to become vaccinated annually for influenza because of the lack of convenience. Example, walking into a CVS or Walgreens, scheduling a PC appointment. I'm not sure I followed that comment too well, but
can you repeat that?
I do think it's more convenient than it used to be.
Here, Pat, I can read it for you. I unfortunately, maybe I didn't copy the whole thing. So one of the outcomes from the COVID-19 public health emergency is that social distancing and quarantining accelerated the convenience sector of our economy, such as e-commerce, mobile delivery services like DoorDash, Grubhub, Amazon, those sorts of things. Do you predict that latency by the general public in the future to become vaccinated annually for influenza because of the lack of convenience? Because you have to make efforts. Do you think that there will be a problem because of that?
Yeah, I don't know how to predict that future, but we are all hoping that after COVID, that I think people are hungry for life to get back to normal. And I think that once we can do that, I think people are going to be out in restaurants and shops and going to these very convenient places where you can shop and get your flu shot, as well as, again, we have this excellent primary care provider network. And so I think that there will be, I think we've been increasing the convenience of getting the flu shot, and we hope that society will get back to the point where we're out and about and it will not seem too inconvenient.
Let me just, one codicil on that. Because pharmacy, we've become reliant on pharmacies for adult influenza vaccination. So that's a good thing. A lot of pharmacies in Rhode Island, they're extremely cooperative. By the way, I did get my flu shot this year. They give good shots. I compliment them every time. They're very good. They're very thorough. And of course, if one goes to a pharmacy that one uses for other prescriptions, other medications, so on and so forth, this is properly recorded in one's record and so on and so forth. So I love this. Let me just say that because of social distancing requirements during the pandemic, this very convenient way of getting flu shots probably became a little less convenient for all of us. Certainly the pharmacy did not want 20 people jammed into a small area waiting for flu shots at the same time, that sort of thing. So it did become, just saying, it did become somewhat less convenient for us. But like Dr. Vivier, I look forward to a more normal time after we receive vaccination for COVID-19.
Okay, we're get close to the hour. I want to say thank you very, very much to Dr. Vivier, Dr. Fulton, and the other panelists who had to leave earlier. I don't know if either one of you have any closing comments. We've covered a lot of ground on the topic of vaccination. I thank you for your expertise and your experience with both of these topics. Is there anything else you'd like to add before we close out?
I would just like to say thank you. Thank you to you for moderating and for the Rhode Island Public Health Association for having the event. Anytime we can talk about immunizations, it's important, and for these excellent briefs. And it's always a pleasure to do anything with Dr. Fulton and hear of his wonderful work.
And also, and I might say with Dr. Rizica, and having met Mike, thank you so much. By the way, I just want to thank the folks who wrote those briefs. I thought they were marvelous. And I just saying, I do look forward to receiving and reading continued work from the Public Health Association. I think that it exists, and people work so hard to keep it going and to help students and faculty and so on and so forth in the state is marvelous, and I'm very appreciative of it. Thank you.
Yeah, I want to echo that as well. Thank you, Dr. Rizica, for your leadership and for the invitation.
Yeah.
Okay, thanks everyone. And I thank everyone that's out there working in the field as well in this time of pandemic. It's a real challenging time, but we are going to get through this, and we're going to learn a lot of lessons and hopefully continue to have these high vaccination rates and even better as some of the lessons we've learned. So thank you all. Patty, any last words?
No, thank you all. If you're not already a member of Rhode Island Public Health Association, if you're affiliated with an academic institution that is a member, and Brown is, but many others, we have, I think, 13 others in the state, you can become a member for free. So just also see if your organization, if it's not an academic institution, is a member at ripha.org. Thanks, everybody. Great talk.
Thank you so much.
Stay safe, everyone.
Stay safe.
Mike and Owen, if you could stay on a minute, that'd be great.
Absolutely. Oh, did Mike he might have just left already, I think.
Oh.
Oh, well.
Okay. Well, I think you've got a lot to work with.
Yeah, me too. I think I'll probably try to aim for more of a 4 or 5 minute one, and then aim for like just 1 minute. We did something here, you can see it. And if you're interested, there's a longer video. That seems reasonable.
That's great. Oh, let me stop.